Well, back with Dr. Grindstaff from El Paso. We talked a little bit about ingrown toenails, and we did mention in that thing a little bit about fungus. I mentioned it because of the summer months, but we didn't get to it. So tell me about fungus. How can we prevent it? Why do we get it? And very importantly, how can a podiatrist cure it?
Well, first of all, fungal infections are extremely common in the foot. Most fungus infections of the toenails actually begin with a fungus infection of the skin. Now, some of these fungus infections of the skin are mild, and people may not even know that they have it. But as you trim your toenails, the fungus is able to get up and underneath the nail. Once the fungus is invaded underneath the nail, it provides the perfect place for the fungus to grow. When you think about it, with your foot sitting inside of a shoe is a warm, dark, moist environment. Just exactly what fungus loves. So fungus grows in that environment, and the nails start to become yellowish, they become thickened, and then later on, they actually become distorted in how they grow and can become painful, actually, as the thickening and distortion occurs. Now, fungus treatment is something that has been a difficult thing to treat for many, many years. Fungus in the nails are extremely resistant, and most of the all of the topical medications virtually that you see marketed in the pharmacies, if you read carefully, there will be a disclaimer on the bottle that will say that this has never been proven to work for fungus nails, even though that's what they're marketed for. So all these topical medicines that people spend fortunes on really don't work very well. And so it requires professional help to really get rid of these fungus infections most of the time. Now, the typical patient who has fungus in their nails can be easily treated with oral antifungal pills. The most common is, of course, Lamisil, which is on the market and has been for 20 years. And what is done is we take a sample of a person's nail and we send it to the lab and verify they have fungus, and then we can place them onto these pills that they take for about a 3-month period of time, and about 70% of the time we can get rid of the fungus with just taking these pills, and nothing else would need to be done. So the treatment for these has gotten much better in the last few years. Another way that these things are treated is through laser treatment. There are laser machines that in 1 or 2 sittings can kill the fungus in the nail. And now they haven't been around very long, so it's hard to know if in the long term they will be as good as the pills or not. Currently, the studies that the companies have released claim to be close to as good as the pills. And so that's another way that fungus can be gotten rid of. Most people need to know, though, that even no matter how you get rid of the fungus, it takes many, many months to get rid of them, 6 to 12 months before the nails are normal. So when people wait for the summer,
even with laser surgery?
Even with laser surgery, because the nails have to grow out. In laser surgery, the laser kills the live fungus, but the nail must grow out to look normal again. So even with lasers, it takes a long time before you know the final end result. And, of course, we get people coming in the summertime because they're wearing sandals, and the truth is they need to come in before that. If they have a fungus nail and they want to wear sandals in the summer, they should be coming in the fall so that their nails are all better by summer.
Well, looks to me they should come in now so that next summer they're fine for sure.
That's right. If they start now, they'll be 100% next summer.
Right, absolutely. That's what it looks. It's like with exercising, yeah. Start. If you want to be good in a good ski season, start exercising in December. So next year in December you might just be okay.
That's right.
Not that December. All right. So for people who, let's just say, take me, I just turned like 58 and I haven't taken an aspirin since mom shoved it into me when I was 15 or so. And, except when I go to a dentist and, I tell him to shoot it up. But rather than that, I just simply haven't taken any medicine. So if I would be a little bit adverse of taking a medicine for this fungus, I should probably go with the laser surgery, right?
Well, the laser surgery is an alternative. It is possible, it is possible to treat the it's possible to treat the fungus even without taking the pills, but it's a much more difficult procedure. Usually the nail has to be removed, and then for topical medicine to do any good, most of the time the nail has to be removed or nearly all removed for the topical medicine to do it any good at all. And usually I will tell people that, if you don't want to take pills, and that is an alternative where you can put topical medicine on, but you've got to be able to get it down to where the live tissue is. The medicine will not penetrate through a nail.
Well, I got that, but I was more kind of saying, the laser. So are you telling me that the laser treatment goes with the bill, or it's the bill or the laser?
No, the laser treatment stands on its own. It does not need pills to be used with laser. Laser works in one or two settings where
Okay, so the laser,
where someone doesn't want to take pills.
And the laser does also not need any topical creams. Am I correct there also or not?
That is correct also. You do not have to put topicals on with laser.
Okay, so we have topical cream, pill, and laser, and out of those ones, the topical cream is the most questionable one. It might never happen.
That's true. That is absolutely true.
Thank you very much, Dr. Grindstaff.